In intensive community settings, there is no such thing as overutilization. Ironically, an entire industry exists to prevent overutilization. Managed care. Utilization management, which historically has focused on overutilization, is missing the point. We are beginning to look at the relationship between needs and the duration of care and model over and underutilization. Our research demonstrates a linear relationship between the indicators on a child's CANs and the amount of money spent on services. As one would predict, more complex children, those with more needs and fewer strengths, require and receive more help and therefore cost more. But our data shows something interesting: deviations from this curve at its base. These are children who are using fewer services and therefore incurring lower costs than would be predicted by their needs. That's called underutilization. But notice that we see no such deviations at the top of this curve. That means there are no children who are using more services and incurring higher costs than would be predicted by their level of need. That would be known as overutilization, and that's simply not happening for intensive community care. Managed behavioral health care was originally designed to prevent the overutilization of psychiatric hospitalization. Historically, overutilization of that service was a real problem. However, applying the same utilization management strategies to intensive community services might be a bad idea. So it appears that overutilization is actually driven by fraud. It's not really a characteristic of the decisions that people make. It's a characteristic of behavior that providers engage in. Do families really want someone coming to their house all the time? Do they really want to drive to take their child to services as often as possible? Receiving care really isn't a form of gold bricking, is it? No. Families just want what they need. Some families need more than others. So how do you invest? Maybe policymakers should consider spending all that money that they are currently spending on utilization management and investing it in helping people who need help. Utilization management should focus on underutilization because that is the single greatest threat for bad outcomes in our system. Care management strategies should focus on managing and optimizing the clinical and functional impact of behavioral health care. It may well be that if we can successfully accomplish this goal, costs are controlled indirectly.